The White House says hundreds of thousands of children aged 5 to 11 have already received their first shot of Pfizer's low-dose coronavirus vaccine. It's been a little bit more than a week since the shot was authorized by the CDC. Meantime, officials say a number of parents have scheduled appointments for their kids in the coming days. Michael George reports.
Federal health officials estimate more than 900,000 U.S. children ages 5 to 11 will have received their first COVID-19 vaccination by the end of the day.
Parents and families across the country are breathing giant sighs of relief, and we are just getting started.
The Biden administration calls it a strong start to the program, which started last week, with an additional 700,000 appointments already scheduled at local pharmacies. About 28 million children in that age group are now eligible to get the low-dose Pfizer shots. Pfizer is also asking federal officials to authorize its booster for everyone 18 and older, citing new data. The third shot offers close to complete protection from severe COVID.
FDA is currently looking at the data for expanding boosters to all populations.
On CBS Mornings, U.S. Surgeon General Vivek Murthy said it's likely the coronavirus will be around for some time, but with the help of vaccines, we'll be able to live with it.
We can ultimately get COVID, I think, to a place where it's somewhere in between the cold and the flu, where, yes, it's a virus that's circulating, but it doesn't disrupt our way of life, doesn't prevent us from seeing the people we love, doesn't prevent our kids from being in school.
Meanwhile, a union representing more than 700,000 government workers has asked the White House to extend a November 22nd deadline to get vaccinated. Michael George, CBS News, New York.
For more, I want to bring in Dr. Mark Klein. He's the physician-in-chief at Children's Hospital New Orleans. Dr. Klein, thanks for being here. Let me first ask you about the big news today on boosters. Is it more important now for every adult to be eligible for a third dose? What's the argument about expanding boosters?
Well, you know, Lana, boosters are nothing new to pediatricians. We're very familiar with the concept. The immune system responds, of course, when it's exposed to a vaccine, but sometimes it needs a little bit of a reminder over time, what we call an anamnestic response, so that the cells in the body that produce that immune response can be reminded about what it's been exposed to and continue to exhibit the same kind of protection that it did when it was initially administered. So I don't think any of us are surprised that boosters would be recommended for all of the adults who have had the vaccine. This is kind of part and parcel of what we do when we vaccinate people.
Well, let's talk a bit about the vaccinations that your hospital, Children's Hospital New Orleans, has been undertaking when it comes to vaccinating younger kids, now that a shot is available for those aged 5 to 11. I'm curious, what side effects, if any, have you seen in your patients?
We've seen nothing significant so far, Lana. We see some sore arms, of course, a little bit of malaise, low-grade fever that can last maybe 24 hours, but the kids tolerate the shots very, very well. And so we've seen really nothing of significance. I would refer to these side effects more as nuisances rather than actual adverse effects.
And we've seen a lot of enthusiasm from parents, but there are also some parents who remain on the fence about getting their kids vaccinated. And we know that there are plenty of kids who are not interested in shots. But tell us, what are some of the main concerns that you've heard from parents, and what do you say to alleviate those worries?
Yeah, well, first of all, I would say overwhelmingly we've seen tremendous enthusiasm. All of the slots we had on our schedule here at the hospital and at our primary care sites to administer the vaccine were quickly filled. And so we've administered a lot of shots already, and we have many more coming up in the next few days. But it's easy to understand why there's some hesitancy. Parents are very protective of their kids. This is a new vaccine. Some people think that it maybe hasn't been around long enough. There's not enough experience in adults or children, perhaps. And then there's a tremendous amount of misinformation out there having to do with all sorts of things. The CDC, I think, has done a good job of dispelling a lot of that misinformation. But in the days of the internet, it just keeps rolling forward. And with each new rumor about the vaccine, about a potential side effect of the vaccine, whether there's a basis for that or not, it introduces some doubt. And so some people are hesitant. But I think as parents see more and more children receiving the vaccine over the next few weeks, and they see that other kids have gotten the vaccine and have done quite well and have not had significant side effects, I think we'll see more and more uptake.
And for the parents that remain on the fence, what do you say to them?
I say to them that these vaccines and this vaccine for 5 to 11-year-old children in particular have been tested very thoroughly. There were 4,700 children between the ages of 5 and 11 that received the vaccine in the pivotal trial that Pfizer did. And the vaccine proved to be very, very safe, highly effective. It protected greater than 90% at preventing COVID infection and 100% effective in preventing hospitalizations and deaths. So having reviewed the data, I'm very confident that the vaccine is both safe and effective, and I've recommended it for my own grandchildren. These vaccines that have been available for adults and adolescents for some time now, and now for younger children, have been very thoroughly studied, and I think you could say that they are as effective and as safe as any vaccines that have ever been approved for any disease. They really are a remarkable achievement of medical science in a remarkably short period of time.
I think the most powerful, though, is that personal endorsement for your own family. Dr. Klein, the White House says that the vaccine rollout for children is off to a good start, estimating 900,000 kids aged 5 to 11 will have received at least one dose by the end of Wednesday. How do you think that U.S. officials work to sustain that momentum? And when can parents of younger kids really expect a vaccine?
Well, those are good questions. I think that as the parents who maybe have been initially hesitant see more and more children of other parents receiving the vaccine and doing well, maybe there will be greater uptake. What we don't want to have happen is have this initial bolus of vaccines given and then see this sort of dwindle off. There are 28 million children between the age of 5 and 11. And so we have a long way to go. Even if we have 900,000 or 1 million vaccinated as of today, less than a week into this, we've got a long way to go before we achieve the kinds of levels of vaccination that we'd like to see among young children. So, we just have to keep after it. We have to keep dispelling the misinformation that's out there. We need to be open, honest, completely transparent with what we are seeing. And I think that will offer a great deal of reassurance to parents, and we'll see more and more kids vaccinated.
All right. Dr. Mark Klein, thank you for joining, and thank you for all that you do.
Thanks for having me.